Welcome to the Head and Neck Oncology Journal Club. This is episode 21 and I am Krishna Kumar Thankappan. Today we are looking at the long-term follow-up of JCOG1008 published online in the Journal of Clinical Oncology by Makoto Tahara and colleagues on behalf of the Head and Neck Cancer Study Group of Japan Clinical Oncology Group. This is the question most of us settled in practice long before the evidence settled it. In the post-operative chemoradiotherapy for high-risk disease, do we give Cisplatin at 100 milligrams per square meter every 3 weeks or 40 milligrams weekly? Most units drifted towards the weekly years ago. It's better tolerated, easier to deliver, and the retrospective literature was reassuring. What we did not have was the randomized evidence. JCOG 1008 gave the interim answer in 2022, and this month it supplies the 5-year answer. Coming to the design, it's a multi-institutional, open-label, randomized, non-inferiority phase 2/3 trial in Japan. 231 patients with post-operative high-risk locally advanced squamous cell carcinoma, randomized 1:1, 132 to 3 weekly and 129 to weekly regimen. The primary endpoint was overall survival. The non-inferiority margin was set at a hazard ratio of 1.32, chosen to preserve at least 30% of the Cisplatin's benefit over the radiotherapy alone. Non-inferiority was met at the third interim analysis. The Data and Safety Monitoring Committee recommended early termination, and this final analysis was carried out 5 years after the accrual closed. The median follow-up was 5.6 years. 5-year overall survival 58.7% with 3 weekly and 71.2% with weekly. Stratified hazard ratio 0.76. Confidence interval 0.52 to 1.12. Well inside the margin. Non-inferiority was confirmed. Relapse-free survival 53 versus 64.3%. Local relapse-free survival 57.2 versus 68.8. Distant metastases were more common in the 3-weekly arm, 25.8% against 8.6. Now, a 12-point survival gap is hard to look away from. So let me be precise about what has and has not been demonstrated. Every one of those confidence interval crosses 1. Adjust for T stage, end stage and primary state, the hazard ratio moves from 0.76 to 0.88 with an interval from 0.60 to 1.29. This trial shows weekly Cisplatin is not worse. It does not show that weekly Cisplatin is better. And there's the reason to be careful here. Randomization was stratified by institution and pathological risk factors, not by T stage, end stage or primary site. Imbalances appeared in all three and each one favored the weekly arm. Now coming to the dose intensity, the authors offer an explanation that speaks directly to our practice. Estimated dose intensity was higher in the weekly arm, 33.6 against 29.3 milligrams per square meter per week. They use this to account for difference from the Indian phase 3 trial by Norona and colleagues, which used 30 milligrams weekly and did not demonstrate non-inferiority. If that reasoning holds, what matters is not the label on the schedule, it is the dose intensity that you actually deliver. On the safety part, Late toxicity, no adverse event differed by 10% or more between the arms. Nutrition support free survival at 5 years, 54.3 against 63.9%, and low feeding tube dependence in both. There were 2 treatment-related deaths, both in the weekly arm, laryngeal edema and myelosuppression, which the authors attribute to the patient's susceptibility and late radiotherapy toxicity rather than to the cisplatin schedule. 3 limitations to carry with you. Quality of life was not collected prospectively. Patients ineligible for high-dose cisplatin were excluded. And that's precisely the group we most often choose weekly dosing for. And the accrual opened in 2012 with few patients receiving immunotherapy at recurrence. The bottom line, weekly cisplatin at 40 milligrams per square meter is confirmed at 5 years as a reasonable alternative in the postoperative high-risk disease. A reasonable alternative, not a demonstrated improvement. And what's the dose intensity you achieve? Because that may be what separates this trial from the ones that disagreed with it. Until next time.